Welcome back to Healthcare Consumerism Radio, and we're going to actually have Rob back on another segment. No, we had to cut him short there due to the commercial, but wanted to start this next segment off by welcoming Beth Griffin from MasterCard. Beth's actually a Superstars winner for us from 2013, and we're glad to have her on the program. Welcome, Beth.
Thank you. Glad to be with you.
And congratulations on your Superstar Award.
Thank you. It's been great.
Now I know you've been in the industry for a long time, and with MasterCard, kind of give our audience a little bit about MasterCard Healthcare and kind of how you all fit into the healthcare space.
Well, MasterCard is really putting increased emphasis on healthcare right now. Historically, we've put a tremendous amount of focus on the tax-advantaged accounts and the related cards, which has been a wonderful business for us. But we're emerging and we're evolving that business now to broaden it across many other areas because clearly the industry is changing, it's evolving, and there are additional opportunities for MasterCard to support the market more effectively. Mm-hmm. So we're excited about that.
Now, when you see, there is a lot of innovation taking place. You look at what we talked about in the first couple segments. Private healthcare exchanges are starting to emerge. What is going to be MasterCard's approach to innovation in this space?
Well, we're taking a couple of different approaches. So let me share a little bit about kind of the way we approach innovation, and then later we can talk a little bit about some of our new innovation solutions. But, from an innovation approach, we really focus on collaboration. We engage very closely with our customers, with industry experts, industry influencers, corporations, et cetera, to try to create new solutions, really understanding the market's needs. And recently we actually held our first Healthcare Innovation Summit with a number of industry leaders at our headquarters in Purchase, New York. It was a great session with some great thought leadership that came out of that. And as a result, we're working toward some additional solutions for a roadmap. And then MasterCard also has always had a tremendous focus on innovation. So from a structural perspective, we have an organization that has a couple of components that really help us in the healthcare group to drive more innovation. We've got our innovation labs, which really focuses on building prototypes and really innovative technology, and we've got innovation management, which really manages the pipeline of innovation. As a matter of fact, right now we have a initiative going on across MasterCard to engage teams to develop business plans and prototypes of new solutions that MasterCard could launch in the future. And each of those teams has executive sponsorship, so we can actually make it happen. And we're really excited because there are several new healthcare-related solutions that are evolving through that process right now.
Now you talk about your partners and some of the groups that you work with. How is MasterCard able to leverage these approaches that you guys are working on in your innovation lab to support the healthcare side of things?
Well, a couple things. So first, we do collaborate with our clients and industry leaders. We also collaborate with our emerging payments team, and we collaborate through the innovation process to create new solutions. And through that, we're supporting the administrators in the market. We're supporting payers, providers, and creating new solutions. It's turning out to develop some really nice solutions for us.
As we have the healthcare law out there, and everybody, it's something that's there that everyone's got to deal with it. I think employers and others and people in the business are all trying to figure out how they deal with it. But what are some of the market challenges that you see that can be positively impacted by card solutions that MasterCard may provide?
I'm really glad you asked that question. Right away, a couple of things come to mind. First of all, clearly the healthcare market is known for its inefficiency. I mean, with close to 18% of GDP, spent in the U.S. on healthcare, it's pretty amazing. So, through that because of that inefficiency, we're certainly looking at our assets and opportunities in that space. I mean, some of the things we've already developed and are continuing to foster are things like virtual card solutions, reassociation of payments and claims, bill payment solutions for payers to providers and patient to provider payments. And secondly, clearly, another thing that comes to mind is just the changing face of healthcare towards the consumer.
Mm-hmm.
I mean, obviously we're moving away from just an employer-centric, broker-centric model and moving toward focusing on the consumer as the public and private exchanges really take hold in our market. And, from that perspective, we're developing new solutions around, again, in collaboration with our partners, to support the underbanked consumer, for example, with prepaid cards so they can more effectively pay for their insurance on the exchanges. We're doing some additional things around payment acceptance on the private exchanges. Mm-hmm. We're also developing, as you're well aware, and we talked about at your conference in Atlanta last year, just a focus on new solutions with incentives and loyalty focus
mm-hmm.
For consumers so that they can actually receive incentives and we can drive loyalty right at the point of sale on a real-time basis. So we're helping as the increased focus in the market is on disease management and wellness and really trying to keep people healthy so that they can keep their costs down. And certainly also from a regulatory perspective, that's certainly a market challenge that we're all faced with. But we also were really excited to be a part of supporting the changes that occurred with FSAs this last year to allow for the $500 rollover.
Mm-hmm.
I mean, that's exciting, and so clearly we're focused on making sure that we have educational solutions and are supporting the industry organizations as the tax-advantaged account cards continue to evolve as well. So those are just a couple things that come to mind in terms of some of the market challenges and how we're addressing some of them.
And I want to kind of touch on, you had mentioned incentives, and I think, as we move towards the idea of healthcare consumerism and employers really putting these plans in place to be consumer-facing, I think the incentive piece is going to be a really big piece to drive people to change. Is there something that you're hearing from your partners that you guys are collaborating on that is a pain point in the incentive world, or are there things that are just going quite fine and you're just going to continue to educate about the incentive piece of healthcare?
Really what's changing here is the whole market, not just in healthcare, but the market in general being so much more in need of an immediate response, mm-hmm. right? Everybody's got their mobile device. They expect a response to their question via text immediately.
Right.
It's the same thing in healthcare, right? So now with consumers, as they go to the pharmacy or they go to buy something, they also want immediate response. And so we have certainly been working with several of our partners to create solutions that drive loyalty and incentives right at the point of sale on a real-time basis. And in 2014, you will see us launch some solutions that specifically drive incentives and discounts because of the purchase of specific products that drive healthy behavior right at the point of sale. And for us, that's very exciting because the consumer's telling us they want it, the market's asking us for it, and we just want to support the market to be as effective as it can to drive healthier behavior in the market.
And, from what I'm hearing, and tell me if this is right, I mean, you guys are really looking to broaden your focus in the healthcare space tremendously due to all these factors, correct?
Absolutely. So, we, as I said, have been historically focused in the tax-advantaged account space, but we are broadening as we look at how we can support new solutions for payer-to-provider payments, how we can support patient-to-provider payments in collaboration with our partners and leveraging our assets, so bill payment capabilities and additional competencies in that space. We're continuing as well to focus and expand upon what we're doing in terms of wellness and incentive solutions because that's huge for the market. And certainly we're looking at analytics and the things that we can do to support payers and other constituents in the market that want to really understand consumer trends mm-hmm. as we continue to have more of a consumerism focus. We need to be able to take the solutions we have and the data we have access to on a near real-time basis and support our market.
That's very interesting. I think, at Forum in Atlanta coming up, we actually were able to secure a panel of physicians, and you had mentioned the physicians in your statement. This is a game changer for them as well. They have to figure out this evolving world too, correct? It's
absolutely. The providers are so, quite honestly, as you know, the consolidation in the market with providers is tremendous because they've got such pressure on them with all the regulatory environment to drive to a more efficient environment or close shop and go join, the hospital system down the street. So it's a real challenge, and we are certainly looking at how we can support more efficient processing of payments, more efficient claims management, and other types of things along those lines to support the provider, but also certainly through both payers and directly through the providers, supporting more effective access to payments from the patients. Clearly, their ROI is directly impacted by the patient's ability to make a payment as quickly as possible.
Beth, we got about 30 seconds left on this segment. Kind of give our audience kind of one or two really good takeaways about what you see in 2014 and what MasterCard is going to be doing.
We are absolutely focused on growing the healthcare market segment. We're focused on innovation and customer collaboration as a key component in our product and business development, and we're excited about 2014 and beyond.
Well, Beth, it is great to have you on the program. To our audience out there, Beth is actually going to be conducting a workshop at IHC Forum and Expo here in Atlanta. Again, she was one of our Institute for Healthcare Consumerism superstars, and we actually recognized her in our annual Healthcare Consumerism Solutions Superstars Award or issue that came out last year. So if you haven't seen that, you can actually see that on the website at theihcc.com. And Beth, thank you so much for your time. Have a great weekend. Look forward to seeing you in Atlanta. To the rest of our audience, please stay tuned for the next segment of Healthcare Consumerism Radio.